Moving on now, lack of funding poses a huge challenge to local manufacturing of human vaccines in the country. Kenya says it needs at least $60 million or 7.7 billion shillings for the fill and finish process and an additional 38.7 billion shillings formulating and producing raw materials. BioVax is now pushing for private partnerships to ensure Kenya attains this goal. With the slow withdrawal of the Global Alliance for Vaccines and Immunization, Kenya, through BioVax, aims to produce 3 critical childhood vaccines by the first quarter of 2027. This is said to reduce the over-reliance on donor funding for human vaccines and health commodities, which has often left many African countries grappling during an epidemic or a global pandemic. Helena Ola tells us more.
African countries import over 90% of vaccines, pharmaceuticals and health commodities, leaving the continent vulnerable to supply disruptions. This was seen firsthand during the COVID-19 pandemic when African countries grappled to get the COVID-19 vaccine and health commodities. So far, in Africa, only Egypt and South Africa can manufacture human vaccines. As Kenya strives to begin local manufacturing, lack of funds still remains a challenge.
The key risk is that we are depending on imports, which is not sustainable. So that poses a risk. So we need to reverse that to be able to reverse from the 70% to below even 50%. If we do that, then we are also building our capacity in the country and also not losing resources, in terms of forex to buy these products.
Thank you. So
Kenya is now pushing for private partnerships to achieve sustainability away from the additional World Bank partnership.
We have 2 stages of how we want to move on vaccine manufacturing. So the first stage is fill and finish, which is what we are doing now. So the fill and finish investment in total will be around $60 million. Just to set up the facility, the factory and everything else. So you have about $60 million. But OPEX, in terms of operations, so in total you are talking about $80 million to have the fill and finish. Then you move to the second phase where you are now, you are not only filling and finishing, but also now formulating and actually producing the raw materials. That is a high investment, which is around $300 million.
Kenya's immunization program operates under a co-financing agreement with Gavi, which supports vaccine programs in low-income countries. Under the current agreement, Kenya fully finances foundation vaccines such as BCG, polio vaccines, hepatitis B, administered at birth, and the crucial DTP combination that shields against diphtheria, tetanus, and pertussis. But the country's ability to protect children against a broader spectrum of life-threatening diseases depends heavily on international support. Critical vaccines such as HPV, typhoid conjugate, pneumococcal disease, yellow fever, and malaria all require joint funding between Gavi and Kenya's government. Speaking during the Eastern Africa Regional Global Health Security Summit, Kenya noted that it needs to ramp up its production efforts.
We are focusing on three products, and each of those products is for routine immunization of children. So the initial capacity, as you produce those products, is enough to supply the country, but also we have capacity to export.
One of the things the Africa CDC has done is open up what we are calling the Africa Epidemic Fund, and we're hoping that we mobilize enough resources there which can be accessed by the member states to respond to the emergencies. But one of the most important things is that the member states need to realign their domestic financing.
This will also help African countries produce vaccines and health commodities at a cheaper price in bulk. According to Africa CDC, Africa needs at least 13,000 specialized workforce for it to meet the 60% vaccine demand by 2040. Helen Aura, NTV.